Hi, welcome to another episode of Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, the dermatologist here, and we have our special guest, Dr. Couto, joining us today to talk about oncology and specifically chemotherapy. And if you haven't met Dr. Couto or know about her, she started with us just back in January, so a recent addition here at VRCCO. But I'm very, very excited for this topic today. I mean, chemotherapy, I feel like so many people have this set idea of what chemotherapy is, either from their own experience with a family member or movies, and it's just, it's going to be great to learn some actual
what it's
knowledge
really like.
what it's like exactly in animals. And we've also got Ponch here today too. He's helping us out as well. But I will turn it over to you, and please, if you're watching today, we always take questions during the show and after the show. So please chime in if you do have any questions.
Great. So I wanted to take a little bit of time just to introduce to the community, what is chemotherapy in pets really like? Because I hear about it all and I've seen it all. Growing up, before I was a veterinary oncologist, I didn't necessarily know what chemotherapy administration was like in pets and how it compared to humans. And there are some similarities and there are a lot of differences, and it's important to kind of know what you might be looking at if you're faced with a decision. Should I pursue chemotherapy for my pet? What are the pros and cons of that? And that's what we're here to kind of help briefly discuss. And then of course, if you are really faced with that decision, you'll be having a lot more thorough discussions with the veterinarian that's taking care of you guys. But I think the first thing to kind of think about is are the treatments similar or are they different? And the actual chemotherapy drugs that we're using are actually very, very similar, and a lot of them are actually exactly the same that would be used in a human and in a dog or cat. There are some only FDA-approved veterinary products that we work with that have been coming down the pipeline very recently that you might hear some chatter about online. But most of the drugs that are used commonly in the clinic are tried and true chemotherapy drugs that have been used for generations in humans and pets alike. And a lot of the chemotherapy drugs that we're using, they are going to be intravenous chemotherapy drugs that go through a little catheter in the vein that are delivered here in the clinic on maybe a weekly to every 3 to 4 week basis. But there are also several chemotherapy drugs that are just given at home by you guys, and you can incorporate it into your pet's lifestyle at home, make it a little treat that they can get at home, taking care to make sure that none of us are exposing ourselves to chemotherapy at any time along the way. So anytime, just to put this out there, anytime you're ever handling chemotherapy, gloves should be involved. You should limit any type of breaking or cracking of tablets or capsules. But there are going to be a fair amount of chemotherapy drugs that we're having our owners and you guys watching administer at home.
That's awesome. And I think a lot of people don't realize that. They think about, drips and, the intravenous stuff, and don't realize that chemotherapy can actually be given as an oral pill that doesn't require you to go to the hospital to give it, although sometimes that happens, but it can be given at home with the proper precautions. So that's really neat.
Yep, that's exactly right. I mean, there's different diseases that I treat different ways. So some of them are going to be, the recommended treatment is going to be an intravenous medication here in the hospital. The longest infusion that I tend to do is about 30 minutes, which can be, it's a period of time that the pet has to be sitting in our little lap and we're holding them during their treatments. But
and I've gone in there. It's a pretty nice, cozy situation for them.
Yeah, and if your pet is ever undergoing chemotherapy and you want any pictures of what it's like, please ask us. My two technicians are just wonderful at making it a very pleasant environment for them, and we work with them to make it as desirable of a situation as possible for them. But I think, one of the kind of main differences between chemotherapy administration in a pet as compared to a human are really, it's going to come down to the dosing strategy. So the dosing strategy that we use in veterinary medicine when we're using treatment for a dog or a cat, the doses are just very, very much lower than they are in a human. And they tend to be on kind of the realm of the doses we're using are about half of what a human would receive for a similar disease or the similar type of chemotherapy drug, with the main reasoning behind that being, we want to spare our pets any undesirable consequences of the chemotherapy drugs as much as possible. When I'm going into a chemotherapy treatment plan with any of my owners, my goal always at the beginning is to not cause any side effects for that specific pet. I don't want your pet having vomiting episodes, diarrhea, not wanting to eat, because that doesn't seem like a very fair quality of life, especially if they're not necessarily involved in the decision-making process of when they want to receive chemotherapy. And so we start at pretty standard starting doses, again, about half of what we would generally use in a human that's receiving chemotherapy. And with that standard starting dose, I really only see about 15 to 20% of pets have a side effect that could be not wanting to eat as well, lethargic or just tired at home, maybe vomiting or diarrhea. And if we were to encounter that in a specific pet, if they were in that 15 to 20%, then we do things differently. We give some medications to help make them feel better the next time they get their treatment. We can reduce the dose, or we always have the option of just stopping the treatment altogether if we're truly feeling like it's prohibiting a good quality of life for that specific pet. And the other side of it, though, is that 80% of dogs and cats that just show no side effect at all. They just breeze through their chemotherapy. Yes, you realize they're getting chemotherapy because they have to come in and out of the hospital sometimes, not always if they're getting the oral kind or the at-home by mouth kind, but they have to come in and out of the hospital. But a lot of my patients just come in bouncing off the walls and happy and excited because they get a lot of treats that day, or they get a little extra pampering by my technicians. So that's kind of the main population of pets that I treat, but the ones that are maybe a little bit more sensitive to their treatment, we do everything that we can to make it as tolerable as possible for them, with the option at any time of stopping the treatment if we just feel like it's not going well for them, or if we're seeing something that we're not happy with.
Yeah. So is it really true you're kind of going for, with chemotherapy, you're looking at maybe reduce any symptoms caused by the tumor and kind of going for this quality of life that's longer, not really going for a cure of cancer? Is that correct to say, or is there some cases where you do go for that cure?
Yeah, I mean, I think that the former is kind of what we're generally going to be shooting for in our pets. The reality is that the reason that higher doses are used in human medicine is because we are trying to go for a much longer duration of survivability. We want humans to live sometimes 60, 70 more years as compared to our pets, which are generally going to live, maybe somewhere between 10 and 20 years, depending on if it's a dog or a cat. So we, generally aren't going to have them living as long as humans, but we also really need to prioritize quality of life, and we're not able to get that prioritized quality of life with those higher doses of treatment that could have the potential to cure. So a vast majority of the time when I'm giving chemotherapy, it is more of a treatment to help keep symptoms at bay, help keep the pet as comfortable as possible and cancer-free for as long as possible, but it doesn't always equate to a cure of the disease.
Perfect.
Yeah.
I have another question too. I mean, on the human side, they can get these, gosh, I don't even know what they're called, the little ports that go directly to the veins. Is that an option for dogs receiving intravenous chemotherapy, or not really helpful?
Yeah, so a little port that's often placed kind of right here at the breastbone is quite common in humans receiving intravenous chemotherapy drugs to help limit the necessity to get access to a vein in the arm, which can be uncomfortable and can just be difficult if you're doing a lot of treatments. The reality is we've tried in dogs and cats to place things like ports to get better access to the veins, and there's a lot of issues with it. We can't necessarily tell them to leave it alone. We can't tell them to stop licking it. We've often seen infections and them falling out just because, the pet doesn't necessarily know that it's supposed to be there and it's going to help them. So we have definitely, I've had a couple of patients that I've actually had to consider that in, where we've had a true issue in getting access to a vein for treatment. And there's a lot of communication that goes on along with that in order to make sure that it's truly recommended. And it does require kind of a little surgical placement of the port. But most patients are just going to have a little needle poke each time they come in for their intravenous treatment, and most patients tolerate it really, really well.
Interesting. Yeah. Interesting. Okay. If you're just getting onto Facebook Live with us, please don't hesitate to ask us any questions. We're here with Dr. Couto talking about all things about chemotherapy right now. Very interesting discussion so far. And then I'll probably just wrap things up. I don't know if there's anything else you want to tell our audience, and also about
our little
this
friend
little
here.
guy. Yeah.
So, just kind of as we were discussing, quality of life is the most important thing for any of my cancer patients that we're treating in the hospital. Whether or not you're getting chemotherapy or not, if you're getting surgery or radiation therapy, any of those cancer treatments that we tend to use, we really do want to make all of the treatment as tolerable as possible for them, and we want them to enjoy it as much as they can. Not every pet loves coming into the hospital, although we do everything we can to make it good for them, but we do try to kind of add little things here and there, give them treats that they might like more than another, talk to them the way that they like to be talked to, hold them the way they like to be held. And at the end of chemotherapy protocols, if your pet is undergoing a set standard protocol where they get 4 to 6 months of treatment, we also do like to have just kind of a little party for them in order to, just acknowledge that they've been through this treatment and that they've gotten to the point that they've gotten. And so we do kind of tend to give them a little sign to wear, a little hat to put on, and then we love sharing those pictures with their parents. So if you guys are watching and have any of those pictures of any pets that you guys have had that have gone through treatment here, we'd love to see them, and I'm sure
please share.
Everyone would love to see them. They end up being some of truly the cutest pictures I have seen, with their little hat and their little sign. So share away if you guys have them out there.
Yeah, great. Well, thank you so much for coming on the show and sharing everything about chemotherapy. I know I love seeing the dogs come through with the hats and the sign, and we also, the whole clinic gets to know these patients because they come in. But it's really cool what you guys are doing and the level of care you're providing for the pets and Ben. It's absolutely great to have an oncologist here, and especially
so happy to be here.
Yeah. Yes. So, is there a question back there, Shelby?
Yes, there's a comment from Heather, and she says, I appreciate how informed the treatment is for McKinley. She just got done with number 2. I know she's in great hands. Between the information from Dr. Couto and her text and the helpful resources of Tripods community, it's been so helpful and reassuring.
Oh, thank you.
That's great. We actually had McKinley in for treatment today. She got her second treatment. We were just finishing up, and she is just a wonderful dog to have gotten to know. And we really, these dogs and cats are our family, and that kind of shows it.
Yeah, absolutely.
Yeah.
Well, thank you, and thank you to everyone for joining the discussion. And if you have any of the more comments or questions, please feel free to write those in on the Facebook page, and we'll be happy to answer those.
It was great being here again.